Good afternoon and welcome to HealthSystemCIO.com's All-Stars panel, The Patient as Customer, Techniques and Tools to Stay in Touch, produced in partnership with CHIME, a webinar tweet chat combo from HealthSystemCIO.com sponsored by Tonic Health. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the Editor-in-Chief of HealthSystemCIO.com and I will be your moderator today. We are having a simultaneous tweet chat hosted by Nancy Wilcox, our Director of Sales and Marketing. You can participate in a separate browser or on your phone by using the hashtag HSCIOchat, or you can simply view the tweet chat in the Media Viewer panel on the right-hand side of your screen. Other WebEx panels we'll be using today will be the Q&A panel, which you can use to send in questions, leave the default set to all panelists, and the polling panel, which will open automatically when we launch a poll. And you can download the deck by using the URL on your screen. It's at the bottom of most of our slides, and that's also being sent out in the chat box. Just so you see how we're going to spend our time today, first we're going to have our panel discussion with Manish Shah, SVP and CIO at Community Health Systems, Albert Villarin, Dr. Albert Villarin, CMIO and Associate CIO at Staten Island University Hospital, Sterling Lanier, CEO with Tonic Health. So without further delay, we are going to jump right into our discussion. Manish, can you give us an overview of your organization and role?
Sure. So we are an organization that is a tax-paying entity based out of Franklin, Tennessee. We own and operate a set of hospitals in 20 states that range. So we operate 127 hospitals in 20 states. Number changes all the time. And we provide primary care services, acute services, as well as outpatient services in those markets that we serve across the 20 states.
Excellent. Thank you. Al, you want to give us an overview?
Sure. Good morning. Good afternoon, everybody. Al Villarin here, Chief Medical Information Officer for Staten Island University Hospital, which is part of Northwell Health System, which is the 7th largest health system in the country. We're based out of New York City and Long Island, and we cover regions up to Westchester, Long Island, and Staten Island with our 21 hospitals in our healthcare network, including ambulatory and air rescue and level 1 trauma.
Excellent, excellent. All right, let's jump right in. Al, let's stick with you on this. How are you measuring the patient experience, and what is your strategy for using those measurements to improve the process?
Great, great question. Well, we started an initiative called the Concierge Program, and what I did is design SurveyMonkey questionnaires that work specific to the entity in question: dietary, clinical, nursing, environmental, et cetera. We have them pick up 3 to 5 questions that we deployed across each of the service lines in the units. So each unit would have one person assigned to collect the data from the patients, et cetera. So we did it with physicians and the nurses and the environment, which was terrific. So they went around and collected 15 to 20 surveys a day across all the 14 service lines. And right now, after a year and a half of running it, we have collected millions of sets of data. We analyzed it for the question specifically. And what I did, I ranked the responses. So if we have a patient that gives us a response that's below the average or below what we want, then it signals one of us through a text message to say, hey, this patient has an issue with a certain thing, let's go talk to them and figure it out. So we've seen a positive input. You know, these are small things that can fester over time, and if they get their press gaining later on, after they leave, they remember this episode as a negative one. So that helps us delineate and get rid of those before they go home in terms of a real live surveillance methodology. So, and it's been running now. I have 65 surveys running every day in our hospital at both sites. and it gives us good feedback on a real-time understanding of the patient's experience and how we can better their ongoing experience day to day.
Excellent. Very good. I got to jump back for a second. Sterling, my apologies. Let's get an overview of your organization and your role.
No, hey, listen, no worries at all. And Al, thanks for kicking off the conversation. Sounds like you guys are up to great stuff. So, brief introduction. So this is Sterling Lanier. I'm the co-founder and CEO of Tonic Health. We're the leading digital survey platform for big health systems. So the short summary is that we allow you to easily customize any type of survey and then deliver it to any patient on any device anytime, and then view all that data back in real time. So many of the things that Al was just talking about in terms of, boy, how do I customize surveys across a range of different things I'm trying to measure and get all that data back in real time. So we're also often replacing those traditional pen and paper activities from intake to, in particular, patient satisfaction measurements, with a much more fun and friendly digital experience that works great for patients and saves hospitals a ton of time and money. Give you a sense for organization, we're based out in Palo Alto, so if you know where Stanford University is, we're a stone's throw from there. Our customers include 15 of the top 30 health systems in the country, and we are also Apple's partner for patient experience. So that's a little bit of us.
Excellent. Thank you, Sterling. All right, Manish, let's throw this one to you. How are you measuring the patient experience and your strategy for improving it?
So we have more of a holistic 360 view of how we look at the consumer or patient that uses a continuum of care platform that actually sort of tries to stay engaged with the patient before, during, and after. And we use multitude of technologies that range from Reputation.com, HealthStream, HealthGrid, that actually do a more real-time text messaging, largely sort of format to try to stay connected with those patients and, candidly, around those that are caregivers or family members of those patients that we are caring for in our facilities.
Okay, very good. Next question. How do you currently handle patient onboarding, and what parts of the process can patients handle before they arrive at the facility? Manish, let's stick with you.
Yeah, for sure. I mean, our journey there begins with, if we're really looking broad, we actually offer online scheduling. So scheduling can occur, appointment reminders will occur prior to the appointment. We do mobile check-in to make sure that the patient has the ability to complete a lot of the pre-work or the pre-reg stuff as they possibly can. We also allow them to do copay and online payment. So all of that essentially can occur prior to the actual experience of the brick-and-mortar facilities that we offer the care through. And then there is the actual registration process, if it's on the inpatient side, that sends them a welcome message, and that therefore essentially begins their activation into the four walls of the facilities and sort of keeps track of that patient through discharge.
Very good, Al.
Yeah, I'm with Manish. I agree. It's no longer a disposition change on a database, right? It's more of an experience change by the patient. I mean, keeping them in contact, whether they're outpatient, inpatient, in a consult, in a referral, they're still under one umbrella, Northwell Health. And we want to recreate that experience for the patients as if they were working with Amazon, or working with Google, et cetera, having one-stop shop on a digital application that they can have on their device or at home to allow them access to all things Northwell. We brand it, we put it out there, and we actually developed a digital patient experience council, of which I am on that, to help guide how we want to deploy this into the future. But you're right, it's now creating that stickiness so that they go to one place to get all information about your healthcare network. So I think we're looking at all the same thing. Digitizing healthcare is going to be a major player in the next few years in onboarding patients and expanding your market share, especially in the competitive areas that like we are in California and New York.
Sterling, what are your thoughts on what you're hearing?
Yeah, listen, I think violent agreement with Manish and Albert here, and very similar to what our customers are doing in terms of digitizing the experience. And I think intake is, and we're used heavily for intake, and I think the folks that are using Tonic for that purpose are really thinking of it as a proactive driver of the patient experience. So particularly as we start to think about patient satisfaction measurement, which usually happens, after a care episode has occurred, and then we send the patient a survey, which is often by, pen and paper or a phone call. But now I think our customers are saying, boy, how do we kind of flip that script and use the intake process as a way to be much more proactive about it? So how can I use, for example, the intake process to also ask questions about their preferences, right? So a lot of folks will say, add into their intake form, how would you like us to refer to you today? Your first name, your last name, how do you prefer that we reach out to you in the future? What are your preferred appointment times? This allows the provider, I think, to be in much more control of the patient experience rather than have to scramble after the fact, particularly if something goes wrong. So same thing, Tonic allows you to we tie into the scheduling system, and then we push out via email or text all those pre-registration forms, and we're seeing over 50% completion rates ahead of time, which is great. But again, it is all around how do we digitize and connect the dots across these different care episodes, exactly what Albert and Manish were talking about.
Very good, Al. Let's go to you. Do you have an automated approach to proactively reaching out to patients about things they should be doing, such as mammograms and different things like that, in order to stay healthy?
Sure. On our ambulatory side, we've integrated a third-party involvement with this to automate the process of, say, anticoagulation following. That's a very critical part of therapy on the outpatient side for cardiac patients. And anybody on anticoagulations knows that changes do occur on a regular basis, and you have to be alerting to that. But what we've done is expanded the capability of a single clinician to monitor many more patients by automating the process. So it monitors their coags, it monitors the medication. If an error comes or a flag comes or they're not being seen in an appropriate time, it reminds the physician to do so. Therefore, population health management is like flying an airplane, right? The takeoff and landing are pretty much the pilot, and everything else in between should be an automated process to get to where you're going. So that's how we've looked at that process, is automating the process so that the physician or clerk or whoever is in that practice does not have to be on the phone, on the computer, on the email. These are robotic processes done in the background. So and also gathering analytics too. So robotic process analytics is something that you can automate 24/7 and monitor patient care really, hands-free, which is where we should all be going because reducing FTEs and saving money is what we want to do, and increasing the experience for the patient. So on the ambulatory side, that's the case. On the inpatient side, of course, EMR integration with evidence-based medicine and CPOE really is a primer for change, because now that we have the patients directly interacting with their EMR system, we're seeing a lot more feedback from the physicians saying, this is more knowledge that I had just a few years ago. I need to apply this to my patient care. So it's a trifecta. It's the administration of the IT, it's the patient experience, education for both the patient and the clinicians and the administration that has to change, and then the back end support, like Manish and Sterling were saying about processes and workflows that have to be automated and accurate.
Excellent, excellent. Manish?
Yeah, so I think very similar. We first talk about the technology. We essentially use the technology, what we call sort of an escalation model that essentially starts with a primary mechanism that is the preferred that the patient would like us to engage them with. So it could range everything from texting, email to phone, phone to email to texting. Just depends on how they've sort of chosen. That being said, our primary preference is texting emailing, and then a phone call. So that sort of is the mechanism we use for how we actually provide that sort of level of engagement. And then, you know, as far as the actual use cases go, the platform actually it has the capability of everything from doing gaps in care. So it all starts with care summaries on the actual the completion of their visit if it's a primary care or an inpatient, you know, the care summaries if they're being discharged. And then we do, you know, things like 24-hour follow-up if it's an inpatient. We do referral management. There's an ability to do secure messaging between the patient and the care team. On the ambulatory side, we have use cases that run campaigns around gaps in care for specific patients, med adherence, patient education, referral management, transition to care. So it really tries to, again, you know, the platform is the sort of gateway to the connectedness with our patients that we like to try to keep them in, and ensuring that they're, you know, based on the particular encounter or episodic encounter that we have with that particular patient, we try to ensure that the right use cases are used as the outreach post the discharges.
Excellent, excellent. All right, we've got time for our first poll, which is going to open now for you. Nice and easy one. Do you currently have a solution to deal with patient onboarding? This is an anonymous audience poll. We just want to get a sense of what's going on out there. So go ahead and answer that, and we will return to it in a moment. Next question, we're going to go with you, Al, on this. Do you go beyond compliance with HCAHPS requirements and the resulting scores in trying to learn how patients feel about the care they are being or have been provided?
Yes, what we like to do is, so what we did over the last 2 years is collect their HCAHPS scores as processed, as we've developed, of course, like every hospital. But then we also went back and elicited specific responses with them after the fact, while they were still in the hospital, and then ran that information forward. So what we did is look at the HCAHPS for a year, collected concierge live data for a year, and did a comparison between the two. And for about 75% of these patients, there is a very large discordance in terms of their score and what they really felt went on. It's an interesting look at the information. And what we've seen by turning on at the 6-month period this concierge program is that we've seen a narrowing of that gap, a closing of what they felt happened and the score they put down by what we explained to them happened and their understanding of that issue live in the environment. So we feel we have good reliance on our data, that we can say we are adding a positive explanation. We're not biasing the patient, we're just explaining them so they can understand what happened during that episode and how we can better prevent those episodes from happening in the future by taking care of them at the point of care.
Very good. Manish? Yeah, so very consistent, very similar. So we use patient sat surveys depending on the actual experiences or the star ratings perhaps of those facilities to try to make sure that, we're really focusing on during the actual time that the patients are within our care. We will run patient sat campaigns to ensure that there is more immediate feedback and an opportunity for service recovery while they're under our care. And then obviously, and again, it's not to influence, but it's essentially to ensure that they're getting the proper care that they really deserve while they're under our care. And then we use a third party to obviously do the HCAHPS and star rating surveys that actually formally go out to those patients on a post-visit basis.
Very good. All right, Sterling, let's look at our poll results. And we see that This is probably good news for you. 25% have a solution, but 75% do not. Does that surprise you?
No, it doesn't surprise me a ton. Just in all of our healthcare experiences, when we're usually faced with the clipboard, right? And there's turning things digital, as I'm sure Manish and Albert can attest to, or is you really need an organizational commitment to do it. So it's not quite as easy as just, hey, let's just digitize this and everything will be fine. So it's really a concerted effort by everyone in the organization to drive that patient experience. So. No, it does not surprise me, but yes, I suppose it's good news for us. And then the only thing I'd say, just in addition to Manish and Albert, they're absolutely thinking about this the right way, is just what we see from our customers is really, as it relates to measuring the patient experience, really comes down to what's the objective here? Is it to drive improvement, performance improvement across the organization for the patient experience? And that really comes down to, okay, well, how do I measure the metrics that matter most to them, right? And it sounds like Manish and Albert are doing an awesome job of that right now in terms of custom surveys and real-time feedback versus using CAPS as a way to, or thinking of CAPS really just around reimbursement task rather than, hey, CAPS scores is what's going to take us to the promised land as it relates to understanding the patient's perspective. So to steal a quote from our customer at Stanford Children's, she'd like to say CAPS is like the bank statement that they get at the end of the year for their taxes, but custom and real-time surveys are like that checking account that they can use on a daily basis to improve the operation. So it's really how do you fill those gaps in the CAPS? I think it just really comes down to what are your goals for or objectives for that measurement.
Very good. Let's stick with you on this one, Sterling. What are some of the challenges associated with getting patients to provide feedback regarding their care experiences?
Yeah, so and Manish and Albert probably have similar experiences that we see. The first is simply survey fatigue, I'd say, and part of the challenge is oftentimes a health system may have lots of different vendors. A lot of it will even, if you don't have a vendor, you'll have some internal initiatives to be pushing surveys out. So there's not always a coordinated platform where providers can really understand, hey, listen, how many surveys are we sending out? Are we doing it by email, by text, by direct mail, by phone? So we found certainly that providers aren't even entirely sure how many times they're pinging that patient in the first place. So the first challenge is, hey, how can unlike it sounds like what Manish and Albert are doing, how can we create a thoughtful strategy around surveying the patient rather than just kind of a spray and pray approach, which unfortunately we see too much. And then the second key challenge is just really getting a broad enough sample, right? So it's always interesting to me when I talk to people at that cocktail party, down the neighborhood cocktail party. People are always kind of shocked to learn that many surveys in healthcare are still phone or direct mail based, right? And that, at least in CAPS, very small minimum survey sizes. So that's really small sample size to base decisions on, particularly important decisions, and it often relates to care, right? As we talked about automating some of the surveys to push out on a regular basis. So I think the key is how do we make it as easy and convenient as possible for folks to tell us about themselves so that we can ultimately collect more data. And the more data we collect, the better we can treat them at a lower cost. So it's really, hey, if we're asking for patients' feedback, we need to respect their time and make it as easy and convenient and simple as possible.
Excellent. Al, your thoughts on that, the challenges?
Yeah. No challenge. I completely agree. I think having a ubiquitous single platform, one portal of entry, is the goal of our DPX, our digital patient experience model, where they have access to surveys and commentary live at their tablet at the bedside, or as well as they're ordering lunch and dinner for the next few days. They can look up their doctor. They can ask questions online. They could text message their clinical care team. All this stuff, it could be one place, one environment that we want to support them. And I agree with Sterling 100%. Like, you don't want to ping them after the fact. If they had a good experience, they may not remember all the good stuff. If they've had a bad experience, they'll remember all the bad stuff, and that's just what happens to come across your age cap score. You grab that person by random choice. but it's analytics, right? If you have a small sample size, does it really measure the quality of an overall hospital? Every hospital is different. Its location, like real estate, people come in, people go. Your understanding of technology is different, so you have to cater the way the processes are, the methodology you use to collect, and the timing for this in the way that the patients would best engage themselves. And we found that usually around day 2 or so to day 3, that's when they're feeling better, they're positive, and they're engaged. Especially the patients' families are at the bedside with them, and they're very much ready to have a good experience and getting better, and they're positive. So we try to get them at day 2 to 3 for our surveys and our interactions, as well as the after discharge follow-up to make sure that everything is going right and they have a good transition to the next phase of their care.
Manish, anything you want to add there?
No, I think you know, I think just to maybe repeat what I think already was covered is, you know, it's really so for us it's a journey, right? It's you know, we're in the midst of rolling out our platform. We're a fairly large system, so with hundreds of thousands of outlets. So you know, I think it's the key point there is, you know, really let analytics drive the campaigns, which may be uniquely different in our settings, whether it's states or whether it's regional markets. But the key is kind of making sure that you have the pulse on really a data-driven campaigns rather than just, I think that somebody suggested, you know, just spraying them with just barrage of questionnaires to try to get a better understanding of their experience through your care systems.
Anthony, it's Al. I just want to jump in what Manish, I totally agree. But I mean, I'm sure he's experienced this too. I mean, you can change the process, you can talk to the patients, but if the clinical care team is unaware, you have to have that immersion of all of the people around that patient, so that lifts up to a positive experience overall, and help the physicians and nurses and care people understand that you're taking care of them, whether they're in a hotel or in the hospital. You're taking care of them, and they'll remember those things and the experiences that they have. So you have to be on your best behavior. You're on stage 24/7 when you're in front of that patient. So your behavior and your attitudes and your respect of that patient is something they'll always remember and eventually end up in a survey, good or bad.
Excellent, very good. Sterling, let's go with you here. What are some of the benefits to receiving patient feedback in real time versus at some point after the experience?
Yeah, so very similar to what Manish and Al have already articulated here. Again, I think unlike most every other service industry out there, healthcare is really just now kind of prioritizing the real-time feedback as a mechanism to enhance that patient experience. So unlike, it sounds like what Manish and Albert are experiencing, you know, most providers are used to getting those results back in months. But the challenge, as Albert was just talking about, is boy, it's hard to get real-time actionability, right? And that's the main benefit is how can we use real-time patient feedback to drive that experience as it occurs and then also intervene if something goes wrong, right? So, for example, you know, alerts can be triggered for instant service recovery. So let's go talk to that patient in the parking lot before they have a chance to post their displeasure on Facebook, right? So it all comes back, again, to this notion of how can we be proactive about driving or creating that good experience rather than reactively measuring it weeks later when we don't have a good ability to change the outcome, right, or often no ability to change the outcome. I think it's the thought leaders like Manish and Albert are saying, boy, I want to be in control of this process, and that's really the key benefit here, right, rather than, you know, just measuring it, and I just can't do anything about it. So.
Very good, very good. All right, Al, let's go with you here. How important is being able to offer patients the opportunity to provide feedback on different devices? Are current conceptions of how patients will interact with portals too narrow to gather much feedback?
I love the question. Yes. So we started out heading down one road and quickly realized that cost, interaction, graphic user interface is a rather difficult thing when you're going down an iPad swing arm, bolted to the wall, encased in glass, encased in plastic. It just seems artificial. We had some patients think that it was part of their bed mechanism or part of their care mechanism, not for them to use as well. So we've slowed that down a little bit, made it more interactive with their TV, and started an initiative just beginning a couple places, having more, two things. One is personalized apps, an app like developing Northwell as a service, right? You have an app and that delivers all the services of our institutions, Northwell, on their own device. So they're familiar with the device, they like it. It's just like they're logging in to order books on Amazon, they're ordering lunch for themselves for the next day. That familiarity of the cultural world we live in, the technological, social aspects of our world, we just want to replicate it in the hospital. That's the first thing. The second thing is video and voice, very, very important. We did a pilot developing our whole patients, having a 15-minute period of time where they can talk to their physician using their voice or FaceTime with the physician up on the floor to say, hey, we have a bed. How are you doing down there? Your bed should be available pretty soon. Any questions? Introduce themselves as their physician and talk about what went on last night, that they were holding the ED. Significantly increased patient satisfaction to say, wow, this person really couldn't get to me right away, but was able to communicate with me by using FaceTime or video to say, hey, I'm here. I'm thinking about you. I see what's going on last night when you were admitted, and we'll be ready to take you upstairs anytime pretty soon. Those kind of touch points, although not clinical, are directly related to clinical outcomes, because now the patient's associating that clinical outcome that they had with a positive experience that they had from a social, in-hospital social event.
Very good. Manish?
Yeah, I think I covered this a little bit ago. Is that, our platform essentially considers sort of that ability to tailor to how does the patient want to be engaged. And so everything from, mobile devices, again, is, I think that's sort of the modern world and preferred mechanism for a lot of folks. But email is still a viable option, and so is, traditional phone calls, if that's really what the preference is on how the patient wants to stay connected with us. So, I don't know that there is any one particular magic bullet here. I think it's really what works for. I think the key is to offer as many different avenues as you can and try to be standardized around each of those outlets so that you're still delivering that standardized look and feel of an experience of connectedness feeling with the patients, but take advantage of as many of the technologies that are out there that, help facilitate that.
Well, I agree, Manish. Oh, I'm sorry, I agree 100% with Manish because we have older patients that are still loving to have the hand-held piece of paper when they get discharged, but their daughter or son has the information on the app. So it's a multi-hybrid world we live in right now until we can migrate everybody over to do banking that's paperless, healthcare is paperless as well someday soon.
Yeah, no, that's a great point, Albert, and I think the challenge that I think some folks take is that, hey, replicating a paper form on an iPad or a phone is not the same thing as offering a mobile experience, right?
Absolutely.
Yeah, and I think so. And I guess I'm speaking from a software development perspective, but again, what a mobile, at least we found certainly in terms of taking a mobile first approach, is like, how do I optimize it for not only that mobile device, and again, the benefit there being your completion rates skyrocket, but how do I then also use that mobile experience to be able to account for languages, right, to easily switch between languages, account for the different particularities of that form factor, right, whether it's a phone, an iPad, a computer, and then also lower literacy rates, right? And again, this is kind of in contrast to portals, which, many health systems are still struggling in terms of utilization. And, do we think it's likely that, hey, okay, a patient's got to log in with the username and a password and then self-navigate to the right survey? That often, and a lot of folks say, well, I got a mobile strategy. I allow you to log into the portal off your phone, right? It was like, well, okay, I don't know that's a mobile strategy. That's, you can access it mobily. Okay, that's one way to describe it, but is it really a truly mobile experience that is going to make it easy and convenient and drive those higher completion rates, which is ultimately what we care about, right? Is we get more data so we can treat patients better at a lower cost. So how do you do that in a mobile fashion? So I think it sounds like Manish and Albert are well down that path.
Excellent, excellent. Very good, very good. All right, let's go to our next question. Is your current approach to understanding patients fragmented because different apps and systems are collecting different bits and pieces of the patient picture? And do you currently have a solution to this problem? Manish?
This is unfortunately one that is, I think the market base in general, it is actually an evolution. And unfortunately, I can't say that we have, a real-time insight. I think it's laggard, to say the least, in terms of the actual mechanics of, the specificity of capturing HCAHPS scores. Unfortunately, it's still kind of, the techniques are evolution, I think, and so is the technology base, at least in the way we are currently consuming it. So I would say this is an area that we look to hopefully improve in this year and next.
Excellent, excellent. Al?
Oh, I agree with Manish 100%. We're behind, healthcare is behind in terms of collecting data overall, let alone patient experience data and what drives patients' positive or negative responses when they're being taken care of by one of our hospitals. The technology is there. The processes are there on the outside. We have to bring them in-house to do the same thing, to parallel the experience of the digital world as within the hospital. But Manish is correct. I mean, we have 20 hospitals, and we're just begun this past year. Now we're into our, I would say, 14th month of continuing, growing the health information exchange so that we can have data across the network about a patient, not just data within a hospital or one experience about a patient. So once that becomes the mainstay, let's say the main anchor for where our data lives, then we'll be able to better understand how patients flow rather than just pulling charts and seeing where they go month to month.
Very good. All right. And for our second poll, which is open right now, for those of you who had a solution, is your current HCAHPS compliance strategy giving you the real-time insights into your patient's voice that you will need as we move to value-based care and look to improve the patient experience? So go ahead and go into the polling panel and let us know where you're standing with that. So right now I want to go to our new feature. It's Ask a Co-Panelist. This is kind of fun, and we'll see what we get. So Al, let's start with you. Why don't you ask one of your co-panelists a question?
I actually, for both of you, because you have different perspectives, one's a leadership of a healthcare network, and one's on the technology side. Do you feel that physicians are prepared to engage at a 100% level for patient experience? Are they embracing the patient experience model at your institutions, or what you've seen in terms of bringing technology to the patient, allowing them to be surveyed live and engaging themselves as part of the healthcare delivery model?
Manish, you want to go first?
Yeah, I'd say, digitization in healthcare is a relatively growing concept, and one that probably has a fairly broad spectrum of participants. And so I think, at least what I see is, I think, sort of the demographics of the providers has a lot to do with their sort of openness to including technology into their delivery of care setting. And I think that will evolve over time, but I think right now it is kind of hit and miss. Some are wildly, sort of excited about that opportunity of how can I actually stay more engaged and current with my patient. And there are others who go, yeah, I still write my scripts on a piece of paper and, hand it to a patient because I see that as a more intimate experience. And so I'd say it's an evolving thing.
Sterling?
Yeah, so I would agree with Manish. It's evolving. I think the key too is explaining the benefits to the physicians, right? Which again, it seems common sense. Who doesn't want to create a better patient experience, right? But it's specifically, why does charting the patient experience or measuring that or creating an amazing experience matter to the physician, right? And that really comes down to two main things. One is, how are we driving less paperwork for them, right? And therefore, less paperwork means less burnout, more time spent with the patient, which all physicians ultimately want more than anything else. And then number two is, how do we help them provide better care, which is why they went into the business in the first place, right? So I always remember one of our early customers at UCLA said, hey, I'm asked a question in our intake form that has revolutionized how we're doing care, and I got my pen out. I was like, oh, this could be amazing, right? Some brilliant insight. And it really was the question I mentioned earlier, which was, how would you like to refer to you? How would you like me to refer to you today? Your first name or your last name, Mr., Ms., et cetera? And it just changed that care experience right off the bat, right? So that you can walk and say, hi, Judy, I'm Dr. Smith, right? Wow, you're just automatically setting up a new experience for the provider, too, to engage in what really, a better face-to-face clinical interaction. So it really comes down to, it may seem like common sense for patient experience, but how does that patient experience really translate to a benefit for that physician themselves, I think is where a lot of folks spend time on explaining those benefits.
Great. Manish, did you have a question for one of your co-panelists?
Yeah, I mean, I would, so maybe a twofold question for the Tonic representation. Maybe help me understand what are some of the pushbacks that you get from potential clients or even clients that you already have in terms of technology adoption and the openness to actually integrate such a technology. Because I think we're, as I said, while we've actually got multitude of technology strategy, I think it's still sort of an evolution of getting penetration to really achieve the true benefits. Do you have a sense, or maybe for the audience?
Yeah, no, absolutely. I'd say it depends a little bit on the use case, but let's talk first about surveying for clinical purposes. That's intake, or that's screening, or that's a patient-reported outcome survey, for example, which are hard to collect because it's after some event, and I need some type of CRM system to push this out 30, 60, 90 days later and collect that data. And it really comes down to, Manish, exactly what you just alluded to, which is around my native EMR, right? My native EMR says they can do it, and it's in a portal, and yeah, it's mobile, right? Which, okay, I guess it's mobile, but we're getting very low completion rates, and we're not creating a great experience. So I think it's, for some folks in healthcare, the idea that it exists in the EMR, you can functionally do it in your EMR, whether true or not, doesn't necessarily mean that you're providing a great experience and it's moving that care episode forward in a meaningful way, right? And it's creating a competitive advantage for that health system. So I think one of the biggest pushbacks we get is that, hey, my EMR, which by the way, very legitimately, a lot of health systems have spent or invested an enormous amount of money. They should use it to its fullest potential for sure. But I think at some point, where do we get diminishing returns on that, and where can a mobile strategy actually make that EMR more useful, right? And the EMRs do a great job of really charting that clinical record. But per our earlier conversation, everyone talks about interoperability in healthcare, and there's a lot of focus on the clinical data, but not many folks are talking about the need to solve for creating or interoperability around the patient voice, right? And that's where you know, I think our point of view on that is that's where we can bolster or make, you know, spread the pixie dust on top of your EMR to make it more useful. So that's where we usually get the pushback the most. That would be on intake surveying side, and then on the patient sat side is, hey, I used Press Ganey for a long time, and CAPS is my source of truth. But I think as you and Albert have already said, is like, I mean, listen, it's your source of truth for reimbursement, but it doesn't mean it's the source of truth for how are you actually doing, right? Is it a true metric of the pulse of the patient? So we'll get that pushback as well of, hey, I really care, you know, I just really care about the CAP scores, and I'm using that as a way to measure ourselves rather than taking the view that I think you two have taken, which is, boy, I want to be much more proactive about driving a patient experience. So those are the major pushbacks we get.
Very good. Sterling, do you have a question for one of your co-panelists?
Yeah, I think for both of you, you know, we've certainly talked a lot about the importance of measuring feedback from patients. Some of our folks, our customers that are often equally interested in measuring staff experience, saying that, hey, listen, staff are often the single biggest driver of a positive patient experience. So are you folks, or what are you folks doing in terms of keeping that close eye on staff sentiment in terms of driving that patient experience? Have you found this true as well, and do you care as much about staff feedback in this overall patient experience process?
Go ahead, Manish. Go ahead,
Manish.
Yeah, I mean, so clearly, you know, healthcare is all about human capital, and the experience of the product and service that healthcare systems deliver is all about the quality of the people. So, you know, it goes without saying that it always starts with first understanding, you know, are they able to, you know, happy nurse, happy doctor create happy patients. And so, you know, it goes without saying, but I think you're obviously very attuned to understanding that, because you know, it's a brilliant question. I think it really does start with your people and ensuring that there's mechanisms in place that you know, survey may not be the most appropriate way, but you know, in most of our facilities we use what we call morning huddles, you know, where we're kind of getting sort of started with each of the shifts of making sure that, you know, everybody has a good understanding of what's, you know, on the docket for today, if there are any critical patients, if there are any safety issues, and so that's a great way to stay, you know, keep them connected and make them feel as though, you know, creating that true patient care setting that creates a positive outcome is the beginning of nearly all, you know, care outlets, as far as I'm concerned.
Al?
Yeah, I can echo what Manish is saying. Richard Branson has noted the saying that you take care of your people and they'll take care of your customers. That's a very, very strong statement, and I agree with him when he said that taking care of your people is a priority. It's all-encompassing, right? They're all in the same environment. They have multiple different pathways of processes they have to understand and facilitate. Some are more stressful than others, and some are our function, our brain functions in terms of processing 5 to 7 things at one time, and then if you don't get to that 8th or 9th thing, which could be the patient on sometimes, that's when we miss out on delivering care for that patient for that day the way we want to. So we have to make sure that we develop processes, develop technology, utilize workflows that enhance the clinician experience and make it easier for them to take care of the patient. So technology, digitizing the healthcare is affecting all the people in healthcare, not just patients. And the better we do that, the better our outcomes will be for patient care satisfaction, clinical care delivery, HCAP scores, reduction of infection, and the bottom line for the hospital finances.
Very good. All right, I just want to revisit the poll quickly. The answers to this were 25% yes, 75% no. So again, a lot of people out there are not quite getting what they need from their approach and their tools. Let's go to Sterling. Sterling, I'm going to give you a few minutes to talk a little bit more about Tonic. So Please, go ahead.
Great, and I'll just go through this quickly, and it's not so much to try to do a sales pitch here, folks. I'm hoping that just to see how a couple of the key themes that Manish and Albert have been talking about can render itself in a survey experience. So if you look at the screen here, I guess what I want you to focus is on all the stuff on the right, right? Not as much on the stuff on the left. And the idea here is if we make it simple, fun, and intuitive for patients to tell us about themselves or staff members, to Manish and Albert's last point there, again, the better data we're going to collect. Well, how do we make it simple, fun, and intuitive for patients to do it? One is, okay, well, let's render the questions differently, right? Let's approach it from a mobile perspective and say, for example, if you look at that birthday cake there, instead of just saying what's your age and just have to enter it in with the number, okay, let's have a birthday cake slider to keep people engaged in this survey, right? And figure out ways that I can access that patient when and where it's most convenient for them, right? Whether it's through email, on my computer, or text on my phone, and do it in a timely fashion. And I think that's really where we're focused on at Tonic is we love analytics, but unless I have a big data set that I can promise you, I'm not going to be able to give you the fancy insights, right? So I think our job number one is how do we create a survey design experience that gets you the most data that you can, right? And as we think about what are the challenges with patient satisfaction or patient data collection in general is, boy, it's really hard to customize. So, you know, to Manish's earlier question about some of the pushbacks on Tonic as well, one of the benefits is with Tonic, you can customize the new survey in 10 minutes and deploy it, right? In an EHR, that often takes tens of, 20, 30, 50 hours with a senior programmer's time. In Tonic, it's can be quick. And number two is a lot of paper, and even when we're in digital, it's radio dials, and it's kind of just transferring that paper form onto a mobile platform. And then lastly, a lot of folks can't get my real-time data back. So if I'm Manish or I'm Albert, it's like, boy, I can't run my organization with lagging metrics here. Tonic just kind of solves for those three big things, right? We allow you to very easily build any survey to collect the data that you care about. Again, this idea about how do I create custom metrics that are most important to my organization. We certainly can tie those into your CAPs as well to provide one integrated solution we talked about from a patient voice perspective. But again, just make it drop dead easy for us to customize our survey. And then let's just make it easy to deliver that survey when and where it's most convenient for the patient, right? So it's whether you're on an iPad in a clinic or via email ahead of your appointment or after your appointment at any time frame, or deliver that via text. Again, the idea being let's make it really convenient for that patient to tell us about themselves, right? And then lastly, to Albert's point there, particularly around analytics, is what can I do with all of that data in real time to take action in the moment to improve that patient experience, right? So again, it's great that I'm collecting lots of data, but if I can't really do something with that data or make it actionable, boy, there's not going to be a huge amount of value for our organization. So those are really the kind of, if you remember anything about Tonic, those are kind of the three big pain points that we're trying to solve for across the board is how do we just create this consistent, coordinated, and seamless patient experience, to use Manish's words, across that care continuum, right? So we don't end up with a fragmented view of the patient, but instead end up with a holistic view of that patient voice. So that's what Tonic does. Big ROI across our health system. Patients and staff love it overall. And just to give you a sense for who Tonic works with, these are a few of our customers. You probably recognize many of these names, and as mentioned, we're also Apple's preferred mobility partner for healthcare. So particularly around the patient experience. So thank you for bearing with me there very quickly. I'll turn it back over to you, Anthony.
And we like the balloons, and it's all about making it fun, right, Sterling?
Exactly.
All right, very good. Well, we're actually out of time. This was an excellent discussion. We covered a lot of ground, had some polls, heard from Sterling, and good conversation with Al and Manish. And so when you close out your WebEx window today, you're going to be taken to a post-event survey. If you could answer that, we'd appreciate it. Regarding continuing education, those of you who hold the CHIME CHIME certification get 1 CEU for attending our events. So let CHIME know you were here, and if you've asked us to do so, we will. If you need a certificate of attendance for another CEU program, you can use the final slide in this deck. You'll receive an email when this archive has been posted to our YouTube channel. And if you would like us to produce a webinar on the topic of your choice, you can reach out to Nancy Wilcox on our team. And of course, you can go to our website to see our upcoming schedule of events. So with that, I want to thank our panel, Manish Shah, Dr. Albert Villarin, Sterling Lanier, and Tonic Health. And I want to thank you, our attendees. Everybody have a wonderful day. Thank you.
Thank you. You too.
Thank you. Thanks, everybody.